Hi everyone, my name is Shannon Ostenby, and for my research project, I have done the effects of music therapy on dementia. And by this point, all of us as nursing students have gone to our geriatric clinical, and we've seen the effects of dementia firsthand, or also if you have grandparents, older aunts, uncles, and family. We all see the devastating effects of dementia, so that's what initially drew me into the topic. And I'm just going to do a quick 5-minute presentation to show what I've learned. All right, so starting over here, the research question is, in dementia patients, what's the effect of music therapy compared to other forms of therapy on mood, behavior, and cognition? When I initially started this project, I thought that music therapy would only have an effect on mood, sort of, they are moving their body, happy, endorphins. But in this project, I've actually learned that it has tangible, quantifiable evidence to support cognition is improved, along with other things. So it's on all three of those things, which I'll discuss. So some background on dementia. 40% of people aged 65 and up have age-associated memory impairment. But what makes dementia is that it's a progressive decline in cognitive functions. And related to the cognitive functions, it's memory, attention, language, and this really affects their activities of daily living, their ADLs. And one quote that kind of drove my project was, "Those with dementia are still people, and they still have stories, and they still have character, and they are individuals, and they are all unique, and they just need to be interacted with on a human level." And that ties into my Erickson theory, which I'll discuss at the end. So the clinical problem is that dementia has a major impact on behavior as well as cognition, and it can be very scary and worrisome for family and friends. And music therapy may be a breakthrough way to reach them. So some symptoms of dementia, I believe that we all have an understanding of this to begin with, but memory loss, communicating, finding words. They can also lead to behavioral and mood changes, wandering, problem solving, and things like that. So from the data that I have analyzed, I have found an overwhelming positive effects for music therapy with dementia. There weren't any harms associated with trying the intervention. So while I found either positive effect or no effect at all in a certain category, it still is clear that it helps overall. So for depression, I found that it was effective in the reduction of depression. Well, I didn't, Van Stier did. And there was also significant reduction according to the geriatric depression scale, moderate positive effect according to Chang, and possible improvement with two other sources of Freeman and Sue. With behavioral problems, a strong improvement was noted by Sue, Chang, and Freeman. There was no effect by Reglio. However, I still take no effect as better than a negative effect, so I still take this as positive, because if some sources are saying strong improvement and another source is saying no effects, I still believe that it should be implemented for behavioral problems. With agitation and anxiety, they found improvement immediately following therapy, so this was an anecdotal evidence of positive effects of it, moderate improvement by Sue, and once again, as I talked before, no significant improvement by Vandersteen. However, with the two sources I noted above, it's still helping overall. And, for example, with the Vandersteen here, perhaps it doesn't have an improvement on agitation, but here it says that there's improved mood. So whether it doesn't help in one category can really help with another category. And also helping with mood and cognition. And the biggest indicator of that was significant improvement on the mini mental state exam. So from the data collected, as I said before, no harmful, only positive effects or no effects. And music therapy should be implemented across the country and across the globe because it's non-invasive, it's safe, there's no side effects from pharmacological intervention, and music is integral to the human experience with enjoyment and connection to family. It's also cost-effective. And this therapy is in accordance to the Erickson theory model that engaging with the individual enkindles the human spirit, brings dignity to the individual, and eases overall suffering. which is definitely in accordance with the Marion Peckham Egan School of Nursing and Cura Personalis, because it's treating them as individuals with full lives that they have led and a new approach beyond pharmacological ways. All right, thank you.